how much I can pull and how strong these are before this breaks.
Oh, wow.
You see how they are fibrous and they are strong. They're like rubber bands. This came out of a living, well, a previously living person. And the reason this is important for us to study is because, these people are dead and they can't speak.
Right.
We have to speak for them. Understand that these are not clumps of blood. That's what I'm trying to get across.
Right.
There's no way that these are blood clots. These are, I call them engineered biostructures.
Right.
So something in people's bodies is programming them to build these biostructures inside their arteries. And for anyone watching who is skeptical, they might think, no, those look like blood vessels. You must have taken the blood vessels or the capillaries. No, let me zoom in. What you think this is, there, you see that structure?
Oh, wow, yeah.
That is made of repeating patterns. And if the producers could show the images, this is from folder number 7. These are repeating patterns at the very high resolution. They look like almost reptilian scales on the side. And yeah, there you go.
Right.
See those reptilian scales? What I'm saying is that looking at this is shocking to me because, number one, none of this belongs in the human body.
Right.
This is being found in people who have, quote, died suddenly, and embalmers have never seen these things until after the given to people. What's the difference between 3 years ago versus today in terms of the numbers?
I wouldn't say it's rare, but it's not to this extent. This is skyrocketed, and we're seeing it in relatively young patients, which is unheard of. We're seeing this in people in their 40s, 50s, 60s. When you start getting into your 70s and 80s, that's when you start having some issues, and it's relatively rare. But people with heart disease, usually these people that we see with these problems, we know has heart disease, because if you have blockages in your heart, you're going to have blockages in your other extremities. So those are the type of patients we usually see this